I am your host, Dr. Jack Braha, and welcome to the Medcastplus show. Here on Medcastplus, we bring local healthcare providers and physicians, experts in their field, to help educate us on a number of medical topics. Today is totally different. I am pleased, excited, I am thrilled to have a patient here today to talk about his experience with his own medical issues, prostate cancer. Taking care of patients is what I chose to do with my whole life, so having a patient on the show, Mr.Phillip Homer, this is an honor. I am excited. As the viewers can see, I am probably more excited than I've ever been on this show because you are why I went into my field, patients. I enjoy taking care of people, and you are a patient of a colleague of ours, and that makes it even more special. Welcome to the show, Mr. Phillip, a native of
St. Vincent and the Grenadines.
St. Vincent and the Grenadines. Hurricane season now. We're worried about our friends out there, but
God will take care of us.
God will take care of everybody. That's true. That's true. And we're really happy to have you here because prostate cancer is so common. It happens to men. If we live long enough, the saying is we're going to get it. And we had Dr. Weiner on the show not too long ago, an expert in the treatment of prostate cancer. And so I know you're a patient of his, and we came to meet.
Very good doctor.
And he's an excellent doctor. And I want you to tell us a little bit about yourself. How old are you now?
Okay, I'm 64 years of age, 64 years young.
64, that's what I say. 29 for quite some time, right?
Okay.
You looking good? You feel good?
Feeling very good.
How you doing after surgery?
Great.
Great. You back to your usual?
Back to my usual self.
Amazing. You look fabulous. You're an inspiration to me.
Thank you.
So back in May, I hear Dr. Weiner, or April, you guys met?
Yeah, in the 19th of April, I had a biopsy done.
A biopsy of your...
For my prostate. And
let's pause there for a second, because I think we're getting ahead of the game.
Mm-hmm.
So in April, you saw a doctor who recommended.
Right.
What symptoms were you having?
Frequent visit to the bathroom at nights.
To pee a lot.
Right.
Number one.
And in the middle of the pee, it stops. While I'm
You go into
peeing,
the bathroom?
it stops, yes.
It starts and stops.
And stop for a minute or so.
Yeah.
Then I have to wait until it come again.
And it'd wake you up throughout the night?
Throughout the night, yes, have frequent.
And this started suddenly, or was it creeping up on you?
This have started about 6 months or so before.
And so you knew something was wrong?
I knew something was wrong.
So what was the first step you took in investigating all this?
Listen to public information. You know, someone who had these symptoms. And I says, okay, I think something is going on with me. And I need to get my prostate checked. So I went to my personal primary care doctor. I think it was the 7th of January. And I got the biopsy done on the 19th of April.
And when they did the prostate biopsy, that was Dr. Weiner at where's he, at Kings County, correct?
Yes, at Kings County.
Okay.
Dr. Weiner was the surgeon.
Yeah.
Mm-hmm.
And so he did a biopsy. How long after do you get a phone call that, hey, we're suspicious of something?
Oh, well, he had given me an appointment to return to the hospital on the 8th of May. So when I went back on the 8th of May, then the doctor said the biopsy came back positive. It was cancer.
Mm-hmm. How'd you feel when the doctor told you that?
I didn't feel any way because I had already made up my mind from before, whatever it is, I'm going to take care of it. I didn't want to delay nothing. So when he told me that, I says to him, Doc, what are my options? And he says to me, well, here is how it works. It goes from 1 to 5. He says, you're not a 4, you're not a 5. You're not a 3, but you're a 2. he says, and you're the perfect candidate for the options that we have, which was 2 options. So he explained to me in details the options and the side effects. So I then asked him, Doc, which option would you recommend? And he honestly gave me his option, and I said to him, I'm going to take it. So he said, well, you can do a little research, and then you can come back, because it's not like anything is going to happen right away. So I says to him, no, I'm going to take your option.
So right then and there, you made a decision.
Make a decision, and he actually made the appointment. He says, I can have this done in 2 weeks.
And what are we talking about here? What did he offer you?
Well,
what did you decide on?
Surgery. So he explained that radiation had no side effect up front, but later on, you're going to have the side effects, which is incontinent. And he says the surgery has a side effect up front, but it will work itself out. So that was the option that I took.
You're pretty confident right out of the cage there. You're just
because
running.
First, my trust was in God, and second, my trust was in the doctor.
So you decide on surgery.
Right away.
And I'm sure you know the day of that surgery. What day was that?
The 6th of June.
June 6th.
June 6th.
So you arrive at the hospital in the morning?
Arrived there about 6 o'clock. And I think about 8:30 or 9, I had the surgery done.
So you're laying there on the stretcher. You've got your little hat on. You got your gown on. The IV's in. What are you thinking before surgery?
Nothing.
You were clear.
I didn't lose one night's sleep over that. As a matter of fact, I didn't tell anyone.
So now the operation happens. Dr. Weiner removes the prostate.
Right.
Did he do it with little cuts robotically?
Yes, he did the robotic surgery where they make some small incisions, like about 5, into my stomach.
And they were really tiny
They were
cuts?
tiny.
So you're ready for beach season. Get the bikini on.
Everything.
Looking unscathed, huh?
Yeah, it's like less pain. I didn't have that amount of pain.
So
And
after the surgery, how long did they keep you there?
One night.
One night. Mm-hmm. Then you went on back home.
The next day.
How were you feeling the next day?
Good.
What did he tell you after surgery?
Well, I went back the following week to get the tube out.
Right, the catheter.
Right, and then I went back the week after for the follow-up. So he says to me, wow, you're looking like a champion. He says, what happened? You flew out the operating room, you flew out the hospital. What next? I says, well, I don't know. You are the doctor, I'm the patient, so let me know. He says, okay, you're here to get the results. And he says, look, everything came back negative. You're about 90% cure.
So you're happy to hear the good news.
That was the good news.
Yeah.
And the follow-up was on the 2nd of August. And he says to me, I'm here like the principal bringing to you your school report. And he says, you have gotten an A+.
You got good grades, huh?
Good grades. Where he said that, okay, you're now 100% cancer-free.
That's pretty good news in the middle of the summer.
Very good news.
And here we are. We're just at the end of August, so you're 2 months out.
2 months out.
2.5 months, and look at Phillip here. Went through a pretty significant surgery down in the pelvis to remove the prostate for prostate cancer, and you're cancer-free now. So Dr. Weiner at Kings County is an artist in this, huh?
I think he is excellent. His team works well. They work together and they make you feel like you're not sick. That's how they make you feel.
I imagine you didn't feel sick. You have
No.
that kind of personality where
No, I don't feel sick.
you're pretty happy, ready to move again.
Ready to move again.
So how'd you celebrate cancer freedom?
Well, first I always give thanks to God. And I give thanks to the doctor and his team because God gives men gifts, different gifts. And doctors get that gift from God.
We try our best, but we know ultimately where our faith comes from and where we're
Right.
headed. But it's really an honor to take care of patients, especially patients like you, because we go out there every day trying to do our best and keep people disease-free, cancer-free. Many of the people watching today, especially the men, are wondering, well, how do I prevent this problem? And unfortunately, for prostate cancer, there may be no symptoms initially. Now, you had some changes in your urine, but getting tested with a rectal exam,
Was the best thing.
prostate test
Yes.
in the blood. So they did that test where they feel the prostate through the rectum. They do a rectal examination. Did they tell you they felt anything during that exam? Or
No, they said it was feeling fine.
It was feeling fine.
Yes.
You see. And then the prostate test, the blood test.
Then they did the biopsy
Uh-huh.
that revealed